Preventive Medicine, William Richardson, MD.
This program is not being used to make diagnosis, administer treatment, prescribe medications, or order tests. The information contained is provided as an educational service. This program is not a replacement for the relationship you have with your healthcare provider. If you have concerns about your health, please contact your healthcare provider's office immediately.
Hello, ladies and gents. This is Andre 3000, one half of the group Outcast, and you're listening to Dr. Richardson on Call on WCLK 91.9 FM.
Hi, and thank you for listening to what was at the time Dr. Richardson's very popular and informative holistic, preventive, alternative health talk radio show designed to save lives, prevent disease, and reverse disease. Furthermore, if you are interested and in need of a holistic alternative medical doctor, you can reach Dr. Richardson at 770-419-4471. That's 770-419-4471. And be sure to visit our website at acpm.net. That's acpm.net.
Welcome to this edition of Dr. Richardson on Call. Hi, I am Dr. William Richardson, and today we are going to take a serious look at uterine fibroids. Why is there such a uterine fibroid epidemic sweeping across America? And why are African American women 5 times more likely to develop uterine fibroids? How and why is it that 50% of women with uterine fibroids develop symptoms so severe that it can have a major impact on their quality of life in terms of the uterine fibroids causing infertility, severe chronic constipation, severe anemia and fatigue, serious disruptive pain in the abdominal and lower back areas? Why are there approximately 600,000 hysterectomies performed every year, many of which may be unnecessary? Stay tuned for this edition of Dr. Richardson on Call, where we will be discussing uterine fibroids, their causes, and holistic solutions. We'll be right back.
Did you know that studies reveal that 86% of your health and well-being is totally dependent upon your lifestyle, diet, environment, exercise, relaxation, rest, and stress management? And did you know that medical care and genetics account for only 14% of your health and well-being? This means that you are 86% in control of your health through living a healthy lifestyle and building a healthy environment. Dr. Richardson and the Atlanta Clinic of Preventive Medicine specialize in reversing disease, preventing disease, and saving lives. Our full-service health clinic offers complete diagnostic evaluations and medical care, lifestyle nutritional counseling, detox programs, immune enhancement, permanent weight loss programs, IV chelation therapy, and alternative treatments for most all diseases and conditions.
Hi, I'm Dr. William Richardson, and I'm inspired and honored and truly welcome you to this edition of Dr. Richardson on Call, where the second and fourth Wednesday of every month from 6 to 7 p.m., we will take in-depth, stimulating looks at the major health issues facing our community today. My friends, the mission of this health talk show, Dr. Richardson on Call, is to reverse and prevent disease as well as save lives. On this show, we request, we encourage, and we really demand your participation. Call us and ask your important questions and give your valuable commentaries when we open up the phone lines. Again, I'm your host, Dr. William Richardson, a board-certified medical doctor with over 25 years of experience. My role on this show is to facilitate our listeners in the how and why of making intelligent health choices in quality medical care, disease reversal and prevention, nutrition, diet and supplements, cleansing and detoxification, immune system enhancement, and many other lifestyle and environmental factors. Also, as always, I'm joined in the studio by my brother John Richardson, who is the writer, researcher, and executive producer for this show, to whom I owe many thanks. Thank you, Brother John.
And thank you, brother, Dr. William Richardson, and welcome out there in Radio Land, as I, John Richardson, am also honored and inspired to be with you today on this edition of Dr. Richardson on Call. And today we have a very, very, very important topic, Dr. Richardson. and that is the uterine fibroid epidemic that is and has been sweeping across America, where we have African American women 3 to 5 times more likely to develop the uterine fibroids, where 50% of the women that develop the uterine fibroids have symptoms so severe that these uterine fibroids have a major impact on their quality of life, causing infertility, chronic constipation, anemia, fatigue, pain, and so on. And then there's a question of hysterectomies, myomectomies, and conservative approaches and the like, and our guest is going to have some enlightenment for us on that.
Oh, yeah.
Yes. So, Dr. Richardson, let us open up this topic concerning uterine fibroids immediately by first asking you to elucidate and enlighten us to the facts of this uterine fibroid epidemic that is and has been sweeping across America. And again, I say, especially the African American community. Just how common are the uterine fibroids, and why should uterine fibroids be such a great concern to all of us, female and male alike, Dr. Richardson?
Well, like you said, uterine fibroids are very, very common. At least 40% of American women in general have fibroids, and 50% develop major impacts on their life. And as you also mentioned, African American women have at least 2 to 2.5, maybe up to 3 times more the prevalence of fibroids than the general population. Fibroids can be very, very small. There can be tens or even hundreds of them. They can grow up to 25 pounds or more. Many women don't even know they have fibroids, and they can even cause fertility issues. They're non-cancerous tumors. They're benign growths, and they arise in the muscular tissue of the uterus, which is a muscle. And our guest is a holistic gynecologist, and we'll be introducing her in a minute, and we'll go over that more. Also, about 1 in 10,000 may actually be cancerous, and you just don't know it. They really don't turn into cancer, but they can just be undiagnosed cancer. About
but
1 in 10,000.
Very small percentage, huh?
Yeah, but when you add up the numbers, then it can be a lot, as our guest and I were talking about. There used to be maybe 600,000 or more hysterectomies now, but because of the managed care and other alternative, more conservative methods, that probably is cut down to half or less.
So managed care has had some favorable impact.
Yeah, indirectly somehow.
It's a financial issue. So Dr. Richardson, now that you've kind of outlined that we do have a uterine fibroid epidemic, especially in the African American community, I'm sure our listening audience would like to know more about what the symptoms of the uterine fibroids are. And what can you tell us about the symptoms that we might experience from uterine fibroids?
You may have heavy uterine or abnormal bleeding, which you can get anyway. A lot of people can get that. About 1/3 of people get that. Abdominal pain and swelling, pelvic fullness, constipation, problems with urination, cramping. Also, with anemia, you can get fatigue and wanting to eat ice. So if you really want to eat ice, that's called ice pica. That could be iron deficiency anemia. Low back pain and infertility. Maybe 5 or 10% of women who have fibroids may be infertile because of it.
So the symptoms. Then we get to kind of a piece on how they're diagnosed, what's the latest medical technology in diagnosing uterine fibroids, and I'm sure our guest, which is a holistic OBGYN, will have more to elucidate on that. But why don't you give us a little...
Yeah, I mean, the most common way is either, pelvic examination is the basic way because, I do some examinations. I try to get many of my patients to see female gynecologists sometimes. But we have ultrasounds that a lot of gynecologists do right in their office, and that's really a good way because it can tell the size. It's a very easy test to do. And then if bleeding is the main problem, you can take tissue samples, and then there's also hormone tests which can be done because a lot of these women have, which is going to be the next question, estrogen dominance.
Yeah, there's hormone imbalances. And folks, before we're through with this show, we will be giving a proactive plan to reduce, reverse, and or avoid the uterine fibroids. And we have a whole list. Actually, we'll mail you a package on that. But before we get to that, and we'll mention that several times, and we'd be glad to mail that to you, we want to talk about what role do the hormone imbalance and estrogen play in uterine fibroids, Dr. Richardson, and why is it that there appears to be such a big issue, period, with hormone imbalances? What causes hormone imbalances, and how can we measure the hormone imbalance, the estrogen levels, et cetera?
Right. Well, the estrogen stimulates the growth of the fibroid. That's why it stops growing so much after menopause. And this is an estrogen-dominant society. First of all, the eating of a lot of the female animals have female hormones, and then they're even given female hormones in addition to that. The types of bacteria that are formed from eating the high, rich Western diet forms bacteria that can break up the estrogen complexes in the colon and have them be reabsorbed, thereby stimulating not only the fibroids growth, but possibly breast cancer as well. So the high-fat diet and the animal intake in general
That's a big issue.
Cause estrogen predominance. Not only that, the pesticides, I understand, stimulate the estrogen receptors, as well as heavy metal poisoning like cadmium, which is why chelation therapy is a possible adjuvant treatment.
So there's a lot of issues with these uterine fibroids, and we're going to get to the dietary and the herbs and all this kind of thing, and we're going to introduce our guests in a minute. But before we do that, we are going to open up the phone lines, Atlanta. We want you to get involved, the listening audience. We know you have a comment about uterine fibroids, female hormone imbalances, hysterectomies, myomectomies. You've had experiences with this. And not only that, there's ovarian cysts, there's fibrocystic breast disease. All these pieces are related to the same causes of this. All right?
Right.
So right now, folks, we're going to open up these phone lines and invite you to get involved. And while you're calling in, we're going to talk to our guest, which we're going to introduce. We want you, the listener, to get involved in this discussion today, where we're looking at uterine fibroids. We would like your questions and comments on this topic, uterine fibroids, or any other subject about preventive holistic medicine. You can call us right now. The number in the studio is 404-880-9255. That's 404-880-9255. I know you have some comment on this subject about uterine fibroids, female hormone imbalances, and the like. Of course, you can call us on your home phone, business phone, cell phone, car phone, someone else's phone, or pay phone. Just be sure to call us and let your thoughts be known. You can call us in the studio right now at 404-880-9255. Again, the number here to get in the studio right now and talk about this subject of uterine fibroids and female hormone imbalances and infertility and etc. is 404-880-9255. And folks, we'd ask that you write down your question and comments so you can be organized, and make sure you turn your radio down once you call in. Again, the number to get in the studio right now is 404-880-9255. Why don't you rush and give us a call right now while we got some lines open, because we want to hear from you. And now we're going to introduce our guest.
I want to introduce a colleague of mine, a holistic gynecologist, Dr. Waquita Calloway.
All right.
Did I say that right?
Yes, you did.
And she's a very intelligent, delightful doctor who I enjoy referring patients to.
Yep.
She graduated, a bachelor's in Emory, graduated from Medical College of Georgia. Is that in Augusta?
That's in Augusta.
Okay.
And then, you went to Georgia Baptist Medical Center and then now it's called Atlanta Medical Center, right?
Yeah.
And OBGYN. And wow, what made you go holistic or think about these things?
Well, for about the first 6 to 7 years of my practice, as I watch women come in, there's a revolving door with the same problems.
Yes.
And I realized that many of their problems could be prevented if they were making some changes and take a more natural approach to their health, which is, for a lot of women, primarily behavioral, diet, lifestyle changes. And I felt that it would be more effective to counsel patients on how to prevent their illness from addressing their root cause issues. And that was more personally fulfilling for me. And I just kind of followed that path, because the other way of just treating people over and over for the same problem wasn't very rewarding to me.
That's good. Well, I of course have the same path as you know. And we're talking about a subject that's a big subject here in America with all of the people. I mean, it's like, what, a majority of African American women have fibroids.
At some point in time in their life.
That's amazing.
The majority.
The majority.
And what percentage of European or white females have fibroids?
They say approximately 30%.
It's probably, and it's climbing.
Still
It
a
is
large
climbing.
number. Still a large number. Wow.
And
Yeah.
the Spanish-speaking population?
They're, right under us.
Right.
Mm-hmm.
So in between, yeah.
Mm-hmm.
So we'll answer the calls together,
Okay.
you and I and my brother, as they're coming in, which they are.
Yeah, and I'd just like her to pontificate and elucidate to us on this uterine fibroid piece. She's had a lot of experience with this.
Oh,
and
yeah.
Seen probably hundreds and millions
Yes.
of patients on this. No, anyway,
Not millions.
she will be.
So we gave it. So we gave an intro. So go on and
What do you got?
see what you
we
think.
what do we need to go ahead and tell us something on
the
this?
one thing that I would
Yes.
like for listeners to kind of keep in their minds from this point forward is early intervention. Unfortunately, most of the women who walk in my door have fibroids that are beyond the natural scope of help. We can work with preventing further progression, but getting a regression when the tumors are as big as oranges is just not realistic.
Wow.
So I would encourage people to, deal with it when they find out when they're usually marble or grape size that they have them, and look at what about their lifestyle and diet and nutrition is promoting fibroid growth. Part of it's hereditary, but as you said in your intro, only about 15% of our health is going to be genetic.
Right.
The rest has to do with our lifestyle and diet. And early intervention can prevent the progression and growth of fibroids, and you can deal with it naturally when you know early enough.
Certainly, and that's the whole point. And she was talking to me about that, the early piece. Wait until they get size of what do I hear? Melons or
Right.
grapefruit and all this kind of thing, and then it's blocking this duct or causing this kind of problem, and then you need to do something because it's threatening your lifestyle, your life, having a major impact on you.
Precisely.
and not to mention other things like endometriosis.
Okay.
Which is very painful. We have some callers.
Yeah, we have a full bank of calls here, actually. Folks, the number here to get in the studio to talk to Dr. Richardson and Dr. Calloway is 404-880-9255. That's 404-880-WCLK.
Hello.
Yes, Louise, are you there?
Yes, I am.
Go ahead and
Can you
shoot
hear-
that question again. I'm sorry, we're having a little technical
Okay.
difficulty. Go ahead.
My question is concerning measuring the level of estrogen. Is there a test that I could get? Usually the doctors just do a blood test, and that doesn't tell much, but I need to know if there's a test that I could get someplace to determine my level of
Yeah,
estrogen.
there's tests. There's saliva tests. You familiar with Great Smokies or Diagnostic saliva tests? And then there's some, Dr. Jonathan Wright talks about that's not as good as the 24-hour urine for estrogens. How do you feel about that, Dr. Calloway?
Well, saliva tests are perhaps in the future going to be of more use. The problem is the standards and the normal values, and that varies from lab to lab.
Okay.
Traditional labs can run the test. The doctors just have to know what to order with the estrogen levels. And just the estrogen levels by themselves is just taking a very small view of it. There are other hormones that are in response to the estrogen that you can look at as well to find out how is it affecting your body. Not only that, there are physical symptoms of an estrogen excess. Primarily, body weight has a tremendous impact on what your hormones are doing. And just looking at your body weight and how it's distributed can also give you some idea of what your hormone balance is.
Okay. All right, we're going to run to another caller. We're going to run to June in Austell. June, are you there?
Hello.
Yes, you're on the air with Dr. Richardson. Thank you for calling, and Dr.
Thank you
Calloway.
for taking my call.
Sure.
My question is, I know there seems to be a consistent correlation between diet and exercise with fibroids, or it seems like any kind of disease these days.
Yes,
But
that's
my
true.
other question is, has the doctor found any kind of relationship between emotional or psychological
Oh, that's a good one.
problems
Yeah.
as it relates to fibroids?
That's excellent.
Secondarily, if you have emotional problems like that, you can overeat. or eat the wrong things or do emotional eating and all those sorts of things. Mm-hmm. And that will give you the same reasons as far as the negative effects of a bad diet. Dr. Calloway, is also a direct psychological link to fibroids?
I feel that there is, and I can't really say that the studies have been done to prove this. However, I've watched it in my own patient population. Women who have stable fibroids are coming in, getting checked every 6 months, and then all of a sudden we get a rapid growth. There's not been a tremendous change in the weight, and I'm wondering, I can't really say diet had anything to do with it, so we'll talk about the stress. There are particular stress issues that will have the greatest impact, and the East Indian or Ayurvedic medicine will address the issues on the order of chakras. Anything that affects that, which primarily emotional issues, relationship issues, can trigger fibroid growth, and Ayurvedic medicine will deal with that aspect of it. So, certainly it can have an impact. I agree with Dr. Richardson, secondarily through poor eating, but just the stress of unresolved issues.
And then you think there are connections with psychoneuroimmunology.
Exactly.
And then the hypothalamus connected to the pituitary. Exactly.
Okay, we're going to run to another caller. We're going to run to Bobby in Alpharetta. Has a question about weight loss. Bobby, you're on the air with Dr. Richardson and Dr. Calloway. Thanks for calling.
Hey, how you doing?
Excellent.
Great.
Good. Blessings to everybody in the studio.
Thank you.
Thank you.
I just wanted to ask a question. It's off the beating path. I wanted to ask a question about detox and weight loss. And I'll hang up and listen for your answer. Thank you very much.
Thanks for calling.
Yeah, well, there's several aspects to that. Some people who are overweight actually, if they're really toxic and have very poor bowel movements, may actually be carrying several pounds of feces around in their colon. About 80% of Americans, it's estimated, may have constipation. And you're not going to be able to lose weight well when you are stuck constipated. In fact, I saw a patient earlier who had a lot of abscesses, that suppurative, that particular disease of the apocrine system. And I believe that if we can alter the diet, we are going to have a major effect on that. We've had weight loss after weight loss after weight loss in our clinics because of dietary change and detoxification.
Big time. Do you have anything on that?
No, I would agree, that if you're moving the waste, and it's true for fibroids as well, if you're moving the waste, you're less likely to accumulate the toxins and byproducts of your waste.
All right, folks, we're going to get ready to take a break. But before we go to that break, we're going to do a health tip brought to us by Dr. Marshall Williams, who's a naturopathic doctor at the Atlanta Clinic of Preventive Medicine. Listen closely.
Hi, I'm Dr. Marcia Williams with Health Tips. Did you know that our fat-rich, fiber-poor diet is part of the reason that uterine fibroids are on the rise, affecting millions of women? Research has revealed that both benign and malignant conditions of the ovaries, breast, and uterus are related to estrogen levels that are way too high. A woman who changes from a high-fat, high-protein diet that is rich in ice cream, red meat, and cheese to a low-fat, high-fiber, mostly vegetarian diet will often experience decreased bleeding, bloating, and even a decrease in the size of the fibroid. This is because a diet high in a variety of vegetable fiber may lower a woman's estrogen levels by changing the metabolism of estrogen in the bowel. Excess estrogen can also be lowered by using vitamin B complex along with 1,000 milligrams each of methionine, choline, and inositol, and a multivitamin mineral that contains at least 600 milligrams of magnesium. Nutritional improvement and regular exercise are powerful ways to create health. Most women are amazed by how much better they feel when refined foods, some meat, dairy products, and caffeine are eliminated from their diets. This is Dr. Marcia Williams with Health Tips.
All right, folks, that was our health tip. And we want to thank Cynthia, Regina, and Jackson and Susan for calling. Just keep holding on. We're going to get to you right after the break, I promise. We are going to take a break. Folks, you're listening to Dr. Richardson on Call, where today we are taking an in-depth look at uterine fibroids, the epidemic that is and has been sweeping across America. The uterine fibroid epidemic that is 3 times more prevalent in the African American community for African American women. The uterine fibroid epidemic that can have a major impact on a woman's health, causing infertility, anemia, pain, fatigue, intestinal problems, eggs, etc. Stay tuned to Dr. Richardson On Call on WCLK 91.9 FM, as we will continue to discuss uterine fibroids, their causes, and their solutions.
This is Dick Gregory. Dr. Richardson On Call will continue after this break.
Hi, and thank you for listening to what was at the time Dr. Richardson's very popular and informative holistic, preventive, alternative health talk radio show, designed to save lives, prevent disease, and reverse disease. Furthermore, if you are interested and in need of a holistic alternative medical doctor, you can reach Dr. Richardson at 770-419-4471. That's 770-419-4471. And be sure to visit our website at acpm.net. That's acpm.net.
All right, folks, we're back from the break, and you are listening to Dr. Richardson On Call. And I'm your co-host, John Richardson, along with Dr. Richardson and Dr. Calloway. And today we're taking a special look at uterine fibroids, the epidemic, the facts, the symptoms, how they are diagnosed, the estrogen connection, the issue of hysterectomy, myomectomy, and other procedures that can be done. And most importantly, we are looking at what is a proactive plan to reduce, reverse, and or avoid the uterine fibroid epidemic. And we have some callers. People are continuing to call in. And by the way, the number to get in the studio is 404-880-9255. That's 404-880-9255. And we're taking your questions and your comments about the uterine fibroid epidemic. And we have a holistic OBGYN in the studio today, Dr. Wakita Calloway. And she's a medical doctor and been practicing OBGYN for how long?
14 years.
Wow, 14 years. Yeah.
So it's GYN only now.
Oh, right. Okay.
No OB.
No OB. Okay. That means something. Okay. We're going to run to another call. Thanks for participating, Atlanta. We're having a wonderful show on the uterine fibroid epidemic. But right now we're going to run to Susan in Austell. Susan, are you there?
Hello.
Yes, you're on the air with Dr. Richardson and Dr. Calloway. Thank you for calling Dr. Richardson On Call.
And thank you so much for having this forum, because 10 years ago, I had a series of issues. I had uterine fibroids, endometriosis, and an ovarian cyst that were all diagnosed at once.
Wow.
Due to the fact that I was unable to conceive. 9 years married, couldn't conceive. Had the myomectomy, had the laparoscopic surgery to stop the endometriosis. And 10 years later, I'm 41 years old. I had my son, 41 years old, and every time I go back to get my fibroids checked again, because they have grown back, I have about maybe 4 or 5 of them. I had 21 removed 10 years ago, and they have come back. But now my gynecologist always wants to recommend a hysterectomy, which she insists you don't want to have any more children, so why are you keeping your uterus? And part 2 to my question is birth control pills, do birth control pills have anything to do with continuing to make them grow? I'll go ahead and hang up for the answer. Thank you again so much for this forum this evening.
Thank you. Yeah. What an articulate commentary and question, doctors.
Yeah, exactly. Well, first of all, there are some effects, and Dr. Calloway can comment on getting hysterectomies, in that sometimes you can get lax ligaments and whatnot, and you may have some issues with urination. And of course, if you get you get your tubes and ovaries removed, that's basically like taking most of your hormones out of your body, and you can get drop in sex drive, osteoporosis, and all those type of issues. The way we would treat fibroids holistically, and it sounds like you're a great candidate for that, is the same way we would prevent and reverse. And we're talking about a low-fat, high-fiber diet, moderate protein vegan approach, mostly avoiding animal protein, regular exercise, avoiding any methylxanthins, including caffeine, tea, coffee, chocolates, pops, all that sort of thing.
That's a common culprit.
And of course, dairy products as well. Keep your colon cleansed, manage your stress well, as Dr. Calloway said, and avoid cigarette smoke, secondhand smoke, then cleansing the colon and eating lots of vegetables. Green vegetables is a thing, and taking, there's certain supplements that I think people have talked about, like essential fatty acids and certain type of vitamin B complexes. What are your comments, Dr. Calloway?
Well, the decision to have a hysterectomy or not really should be based on how bad the fibroids are impacting your quality of life, how large they are, how much they're destroying the uterus or impacting other organs. Certainly in a rapid growing situation, you have to be concerned about the overall impact on the rest of your body, because they do become drains. They're like growing parasites. To address your issue about the pill, and I can speak to you on professional experience with this, some women use the pill to control the heavy bleeding. There are other ways, maybe more natural ways, but not every woman is capable of carrying that out long term, indefinitely until her menopause. So the pill is used to do that. In some women, the pill will stimulate growth, and the test is you take it 3 months. If the fibroids have grown, you discontinue the pill, monitor for 3 more months, and see if there's been a regression or at least a stabilization. At that point, a decision may need to be made about another form of a non-hormonal form of contraception. So it is a case by case. I do have women on the pill who have very slow to no fibroid growth. So it does not affect everyone in that way.
All right, folks, we're talking about uterine fibroid epidemic, having some great questions. The number here in the studio is 404-880-9255. That's 404-880-WCLK. To receive a free copy of Dr. Richardson's proactive plan to reduce and reverse and or eliminate uterine fibroids, or for more information on Dr. Richardson's holistic medical preventive practice, and the website address is www.acpm.net. That is www.acpm.net. And Dr. Calloway, if people want to get in contact with you, what number would they call and what website? I revisited your website. Can you tell us that?
My office phone number is 678-205-0405. And my website is www.holisticgynecology.com. And holistic is spelled with an H.
With an H.
What's that number again, please?
678-205-0405.
Thank you.
Holisticgynecology.com, correct?
That's correct.
Okay. Well, folks, we're going to run right back to the callers. We really appreciate you holding callers, and we appreciate the listening audience out there in Atlanta listening to WCLK. Right now, we're going to run to Cynthia in Atlanta. You have some comment you want from us or going to give to us about diet. Hello, Cynthia.
Hi, and thanks for taking my call.
Sure.
I was diagnosed with fibroids about 5 years ago, and I had a procedure called a myomectomy.
Yep.
That was pretty successful. I wasn't told to go to a vegetable-based diet, but that's what I did, and I had success with it, and that they haven't returned. But I was also told that if I wanted to give birth, it would have to be done through cesarean because of that procedure. And I wanted to know if that was a common case for women that have experienced a myomectomy.
Were you told that before you had the myomectomy?
No.
Okay.
Dr. Calloway.
Depending on where the fibroids were removed and the depth of penetration in the uterus would determine whether or not a C-section is necessary. Wherever the fibroids were, that area of the uterus was closed, but it healed with a scar. The scar is weaker than the normal uterine smooth muscle, which increases the risk of rupture during labor. So the rule of thumb to prevent a rupture, which is a true catastrophic medical emergency in labor, they often recommend a cesarean section if the uterus was penetrated to the cavity. So if your doctor did recommend that, you may want to ask the question, was this because my uterine cavity was entered during the myomectomy? In women who do not have uterine cavity entry, it is possible to attempt a vaginal delivery.
All right, Cynthia, we're going to have to run. What a great question, and I find it interesting that she didn't know that she'd have to have a cesarean birth due to the myomectomy. She wasn't told that on the front side.
Right.
Is that, that's
Sometimes it's mentioned as because you don't really know till you get in there whether or not that's going to be the outcome, but it certainly should be mentioned in the discussion, for future childbearing.
That's what I was thinking too. All right, folks, we're talking about uterine fibroids today, and we're going to run to another caller, and that would be Regina in Decatur. Regina, you're on the air on Dr. Richardson on Call. Thank you for calling today.
Yes, I was calling because I'm kind of radical, but I want to know: is there any research being done to show the long-term effects of the childhood vaccinations we receive that could be pre-exposing us to these cancers and all these problems that we see rampant in the black community? It's not just diet, because genetically, what I'm seeing a lot of black people under immense stress, and they still look great from the outside. And they can't look that great from the outside if they're really that messed up on the inside. I think, you know what I'm saying?
Okay.
I just want to know, can we target, or maybe is there any research being done to show what the prenatal care we received 30, 40 years ago with the experimental drugs and the different things, is that an effect 20, 30 years ago on women of my generation from what my mother may have taken 30 years ago?
Let's go ahead and answer that, and thanks for that question.
Yeah, that's you can find various opinions about that. I happen to have 6 children, and we didn't just rush and immunize. We did it at our time, and then we avoided the mercury-based immunizations. I certainly have mixed feelings about it. If you're protected here in the United States in a way because of what we call herd immunity, because many people are immunized, but there are outbreaks. Now, we plan to travel to various areas in the world, including Africa and whatnot. And if there's an outbreak there, I probably wouldn't like that. So we may actually use immunizations. Don't like them. They may be beneficial. It's very controversial. I think there's a lot of distrust. There's been a lot of sloppiness in the medical profession as far as putting them together. They may have benefit. I think they can be a double-edged sword. They can go either way. You have comments, Dr. Calloway?
Yes, I would agree. I think there is some evidence coming down the pike, but I think part of the reason some people respond negatively to immunizations may have something going to do with something else that would make them not suitable. And what I'd like to see evolve is a way of testing who would have an adverse reaction to an immunization. They definitely play their role in preventing disease spread. But I do want to quickly address your issue of how people look on the outside and what's going on the inside, because I see a whole host of very attractive women. We, as a group of people, spend a lot of money on our outward appearance. And I can tell you from the high blood pressures and the very enlarged uterus that not everybody that looks good is actually good on the inside. Unfortunately, you don't start looking bad on the outside until your disease is pretty far gone. So you still need, the exams to know what's going on a yearly basis, because you can have some hidden things going on that is not yet affecting your appearance.
Most people on the planet who are HIV positive look great.
Yes, they do.
And back to that diet thing, I mean, the fast food, junk food, just look in our communities. They're on every corner and every stretch of our community, and people having bongs and ho-hos and coffee and Coca-Cola in the morning instead of fruit and, high-fiber cereal and all this kind of thing. Right now, we have a full bank of calls still, Atlanta. We really appreciate your participation in our show tonight, Uterine Fibroids and Holistic Preventive Medicine, and we appreciate your contributions. And right now, we're going to run to Jackson in Atlanta, has questions on symptoms. Jackson, are you there?
Yes, I'm here.
Thank you for calling.
I have 2 questions. As far as early diagnosis of fibroid, are there any early symptoms that a person would display or have without going to have the test or anything? And also, question number 2, as far as a person having already the hysterectomy or suffering from fibroid, what are some of the things that they can do on the road to recovery to prevent the reoccurrence of the cyst recovery from the hysterectomy?
We'll answer that. Thank you, Jackson.
Well, yeah, if you get a myomectomy, you get the fibroid cut out, and you want to know what to prevent it, that would be the preventive holistic diet and all that sort of thing. And then what was the first question I thought was interesting?
He was asking, We drawing a blank on.
Yeah.
Was that the second question you just answered?
Yeah, that was the second question.
Oh, you wanted to know diagnostic procedures and tests.
Yeah, and a lot of them are asymptomatic.
A lot of them are.
Yeah.
Warning signs may be a woman who previously has a normal menstrual cycle with no bleeding until her period, all of a sudden bleeding before it's time for her period. Pain with physical intimacy. Pelvic examination in a doctor's office may outline an irregular shape, but the smaller ones may be missed. Pelvic ultrasound is really the best tool for that. The transvaginal, that's an ultrasound done via the vagina, can really outline what's going on in the uterus very well.
Even the small ones?
Even the small ones. And I am amazed how many times I'll do a pelvic exam and say, I'm not sure of what I'm feeling. Let me just do an ultrasound, which I can do in my office. And lo and behold, I'll usually discover a couple of things I couldn't exactly feel with my fingers.
All right, folks, we're going to run to another call. That would be Marcel in Marietta. Marcel, are you there?
I am.
You're on the air with Dr. Richardson and Dr. Calloway. Thanks for calling Dr. Richardson on call today.
You're more than welcome.
Please turn down your radio, Marcel.
I'm sorry about that.
Oh, no problem.
Mainly, I was calling because I was diagnosed with fibroids in '93 when I became pregnant, and have not had any problem conceiving, and have not really had any symptoms that I would call problems. So I guess my question is kind of proactive. What do I look for to determine if they are degenerating or anything that would cause me problems in the future?
Well, I mean, you can get ultrasounds and see if it's growing, and that would be a thing in a gynecologist's office. And then you certainly want to be on a proactive plan to avoid the further growth of them with the correct diet. And
other problems that can develop from that incorrect diet.
Yeah, that's right. Besides benign fibroids. Dr. Calloway?
Right. The ultrasound, sometimes you can see degeneration on an ultrasound, but degeneration is often accompanied by severe pain. So all of a sudden, if you're getting a severe pain, that's something to investigate. What that means is that the center of the fibroid is dying or changing. Doesn't necessarily mean the fibroid is going away. So just following up on what your body's telling you can often guide you as to what you should do with your fibroid. But monitoring that size is going to be your ticket. Since you are asymptomatic, your fibroids could actually grow to be quite large and you not be aware. So your yearly pelvic exam or 6-month exams, which is what I advise for my patients with fibroids, for follow-up.
Yes, folks, and please be aware, it's just not uterine fibroids. It's fibrocystic breast disease, it's ovarian cysts, it's breast cancer. It's all kind of problems that can develop from incorrect diet. We don't want to wait till we have symptoms and all this kind of thing to wake up the diet. We want to be proactive. We want to be preventive. And that's why we have this show, Dr. Richardson on Call, to pontificate, elucidate, and illuminate the preventive holistic approach to living here in America, so we don't get swept away by all these illnesses that occur. So we're going to run to another call. The number here is 404-880-9255. Maybe give us a call. We have some time left in the show, but we're going to run right to Diane in Atlanta. Diane, are you there?
Yes, I'm here. Thank you for taking my call. I've been diagnosed with fibroids, but I was told that mine were small, and I was calling to find out, is it going to be evident that mine will continue to grow? What should I expect? I do have pain, but mine is mostly cramps that I've had since, I was 16. It's not anything that just started since I got the fibroid.
Yeah, a lot of people have cramps that they're probably used to that they really wouldn't have. And from my way of thinking, in the ancient world, there was absolutely zero fibroids and breast cancer and prostate cancer and other things. So I would urge you to get on the correct diet, which is low-fat, high-fiber, moderate vegetarian protein diet, and avoid a lot of animal products and just avoid caffeine altogether, and really try to be proactive in that sense. Dr. Calloway?
Yes, I would agree. Diet would be the first step to take if your fibroids are small, but you want to stay on top of it because, yes, they can grow. The key is, modifying the diet. Unfortunately, many of us are addicted to the convenience foods, and it's how they're prepared that stimulate the growth. So you want to get educated on the proper nutritional approach to this because you can control it that way.
That's right, folks. And what we also want to talk about is lifestyle and nutrition. probably in Dr. Calloway's office, and I know in Dr. Richardson's office, we do lifestyle nutritional counseling. It's a key. It's the most important thing you can address, the lifestyle and the diet and the environment. And it's 86% of your health or some such statistic like that. And that's what we want to focus on, testing and blah, 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 this and that, all that should be done. But the lifestyle and the diet, not only for uterine fibroids, but your whole health picture. So remember that. That's key. And really all doctors should be doing lifestyle and nutritional counseling, but all doctors may not know about lifestyle and nutritional counseling. So anyway, we're going to ask, again, Dr. Calloway, if people want to get in contact with you, you being our guest today, what number would they call?
They can reach me at my office at 678-205-0405, or you can visit my website at www.holisticgynecology.com.
And that number again, phone number?
678-205-0405.
And it's holisticgynecology.com.
That's correct.
Okay.
Great.
All right. Well, folks, we're having a discussion about uterine fibroids, and we really appreciate your participation today. And now we're going to go for a health tip brought to you by Dr. Marsha Williams, naturopathic doctor in the Atlanta Clinic of Preventive Medicine. Listen closely.
Hi, this is Dr. Marsha Williams with Health Tips. Did you know that fibroids, as well as other pelvic disorders, are also manifestations of blocked energy in the pelvis? When unresolved issues surrounding relationships, creativity, and/or a sense of security exist, the pelvic area of the body, as well as the lower back, can become vulnerable to disease. If you can think of the uterus and ovaries as both being literally and figuratively creative space out of which women can produce babies, relationships, careers, novels, insights, and other creative or artistic works, then you can understand that when energy is not flowing smoothly in this area of the body due to emotional conflict, gynecological problems such as fibroid tumors can result. Therefore, working on energy blockages in the pelvic area by therapies such as acupressure, acupuncture, tai chi, and massage can be of great value. Also, apply castor oil packs to the lower abdominal area 3 times a week for 1 hour per session. During this time, attention should be given to one's thoughts, images, and feelings that arise during this treatment. This is Dr. Marsha Williams with Health Tips.
Yeah, that was a powerful comment by Dr. Marsha Williams about the emotional aspects of, and that perhaps addressed some of our other callers asking about that. Folks, right now we're going to take a break. We appreciate your participation today. You're listening to Dr. Richardson on Call, where today we're taking an in-depth, stimulating look at the uterine fibroid epidemic that is and has been and will be, unfortunately, sweeping across America. The uterine fibroid epidemic that is 3 times more prevalent in the African American women. The uterine fibroid epidemic that is having a major impact on women's health, causing infertility, anemia, pain, fatigue, and intestinal problems. Stay tuned to Dr. Richardson on Call on WCLK 91.9 FM as we continue to discuss this uterine fibroid epidemic, its causes, and holistic solutions. We'll be right back.
This is Dick Gregory. Dr. Richardson on Call will continue after this break.
With over 25 years of experience and success, Dr. William E. Richardson, MD, and his experienced staff of professionals make up the Atlanta Clinic of Preventive Medicine. They specialize in reversing disease, preventing disease, and saving lives. They specialize in treating potential causes of ill health, not just suppressing symptoms. They specialize in blending the best of both worlds of conventional modern medicine and holistic preventive medicine. For more information on Dr. Richardson, MD, and the Atlanta Clinic of Preventive Medicine at www.acpm.net.
Hello, ladies and gents. This is Andre 3000, one half of the group Outcast, and you're listening to Dr. Richardson on Call on WCLK 91.9 FM.
All right, Atlanta, we are back from the break, and you're listening to Dr. Richardson on Call, and we appreciate that. And I'm your co-host, John Richardson, along with Dr. William Richardson, and along with our guest, Dr. Wakita Calloway. And today we're discussing the uterine fibroid epidemic. We've been discussing the facts, the symptoms, how they're diagnosed, the estrogen connection, hysterectomies, a proactive plan to reduce, reverse, and or avoid uterine fibroids. And we've been having a great discussion about this. And Atlanta, we appreciate your participation.
Yeah, and we want to say we're thrilled to be able to offer this preventive holistic show and take advantage of it. We've had people make very positive changes, and that's what it's all about, is education. I want to really thank our special guest, Dr. Waquita Calloway.
Well, thank you for having me. It's been a pleasure.
Yeah, it's been excellent. And we want to invite you, the listening audience out there in Radio Land, to stay tuned to Jazz 91.9 FM for Jazz at Sundown with Renee Williams at 7 p.m. And we also want to promote our next show, and that is the number one fear facing men. Drum roll, what is it? Prostate cancer, where we will be discussing the causes and the holistic solution, September 8th at 6 p.m. Don't miss that show. It could be pretty interesting for all of us. A lot of people being stricken with prostate cancer. So we'll be looking at that September 8th at 6 p.m. And we want to say again, for more information on Dr. Richardson has a proactive plan to reduce, reverse, and or eliminate uterine fibroids, which we'd be glad to mail to you. Or for more information on Dr. Richardson's holistic preventive medical practice. And the website address is www.acpm.net. That is www.acpm.net. And Atlanta, we realize you've been very interested in this show. We've had a full bank of calls all the way through the show. Great questions, great experiences, questions about the lifestyle and the diet and success stories and pregnancies and blah, 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 all this kind of thing. We really appreciate that. And we appreciate, obviously, having this guest again, Dr. Waquita Calloway. And again, the number to reach you
is 678-205-0405. Again, that's 678-205-0405.
And the website
is www.holisticgynecology.com.
Yes.
All right. Yeah, we really are serious about this, Atlanta, and we want to bring information to you for you to use every day and let your families know about it. We want to have an impact on stopping all these major epidemics.
That's right. We also want to take this moment to give thanks to those responsible for producing this show. That would be the producer, Harriet Harris, engineer Tracy Ross, call screener Lorenzo Kemp, executive producer John Richardson, and of course, director of talk show radio here at WCLK. That is Reggie Hicks, who just dropped in on us to say hello and give us a pat on the back. So we really appreciate this. We also want to give underwriting credits and let you know that Dr. Richardson on Call is brought to you by, in part, the Atlanta Clinic of Preventive Medicine, Dr. William Richardson, MD, DetoxMovement.com, Dr. Marsha Williams, ND, Pepper's Restaurant, Basima's Absolute Therapeutic Massage, Loving It Live, Raw Foods Restaurant and Delivery, American Fidelity Mortgage Corporation, and Omnitech Institute. We really appreciate that. And again, Atlanta, we'll be back in actually a couple weeks. So be sure to tune in. For Dr. William Richardson, this is John Richardson signing off and inviting you to join us on our next edition of Dr. Richardson on Call, September 8th at 6 p.m., where we will be discussing the number one fear facing men, and that is prostate cancer, where we will be discussing the causes and holistic solutions. Atlanta.
Hi, and thank you for listening to what was at the time Dr. Richardson's very popular and informative holistic, preventive, alternative health talk radio show, designed to save lives, prevent disease, and reverse disease. Furthermore, if you are interested and in need of a holistic alternative medical doctor, you can reach Dr. Richardson at 770-419-4471. That's 770-419-4471. And be sure to visit our website at acpm.net. That's acpm.net.